Good afternoon. Hi, my name is Josh Golden, and I will be your host for our first ever NatCon at home. In a few moments, I'll tell you a little bit more about me, but first, I'd like to give another minute or two for people to join us. So, while we wait, how about we get to know you a little bit by starting a question and answer? So, in this virtual world, it's always interesting to see where people actually are in the real world. So, please let us know where you're joining us from. I see Minneapolis, okay, Iowa, Ohio, Alexandria, Virginia. Full disclosure, that's where I am. Silver City, Trenton, Whittier, California, Jefferson City. We've gotten a lot of the country represented here, which is wonderful. And as I see names coming in from Arizona and Minnesota and New Jersey and New Hampshire and California, I just wanted to reach out and say we hope all of you are well. We hope that you're finding some joy in this challenging time, and we're thrilled and find a tremendous amount of joy in you joining us. So welcome from Philadelphia and San Antonio and Nebraska, Ohio, West Palm Beach. I know Florida has been having a rough go of things lately, so we hope you guys are all well and healthy. North Carolina, Maryland, Missouri. I have not seen yet Hawaii or Alaska, so if you're there, shout out. Would love to hear from you guys. Very early in Hawaii, so not expecting too many people from there. Colorado, okay, Rochester, New York, know it well. Utah, Scottsdale, Arizona. Seeing a lot of people coming in from all across the entire country. Anybody joining us from outside of the country, I'd love to see that as well. So great. The other fascinating thing to us during this virtual world is it's making it easier for people to attend our events and helping to grow our NatCon community. So tell us, which of these groups do you best identify with? Are you a provider? Are you someone with lived experience? Are you do you have a family member who is experiencing mental health issues or substance use disorder? Or perhaps none of these? Some people might have just clicked here accidentally, and if you have, welcome and welcome to the family. We see a lot of providers. 63% right now are listing as providers. A lot of family members, people with lived experience. Having gotten to know the NatCon community over the past few years, what's remarkable to me is what a family you've become with the providers and people with lived experience and providers who have lived experience. It's really a remarkable cross-section of America and really points to our ability to do wonderful things for our clients, for our patients. So as we look at these numbers, we've got right now 64% providers, 29% family, 20% with lived experience, and 19% none of these. These might be legislators. These, again, might be people who've just joined us randomly for a fun day, for a day of learning. So thank you all for joining us. We've gotten 1,524 responses. So we're getting a good sense of the cross-section. And I think soon we will be able to kick this off in earnest. Well, okay, so I believe we have quorum, so good afternoon. And for those that have just joined us, my name is Josh Golden, and I will be your host for our first ever NatCon at Home event. I'll be taking you through our program and each of our wonderful speakers. So, first things first, you probably don't recognize me, and that's because my team and I are usually running around backstage as producers of NatCon. We're in a new virtual normal, so they've allowed me from backstage to come and be in front of the camera. And while we'll be missing seeing each other in Austin, we're delighted to be able to continue offering you the best speakers and thought leaders in our field. Now, this is a chance for you to take part in an online experience where you'll hear from the best of the best, all from the comfort of your own home or your office or wherever you happen to be. It's a new sort of thing, but it remains an opportunity to be inspired, an opportunity to celebrate fellow members doing amazing work, an opportunity to enjoy the things that have made NatCon the leading event in our industry. So without further delay, let's kick off NatCon at home.
Please welcome President and CEO of the National Council for Behavioral Health, Chuck Ingolia.
Welcome to NatCon at Home, our first ever virtual conference. Those of you who have come to NatCon before know that our conference offers you incredible learning experiences, great opportunities to network, and most importantly, the ability to leave the conference feeling energized and rejuvenated for the important work that you do every day. I hope that today's conference provides you with all of those same elements, and I'm so glad that you've chosen to be with us today. I think it would be fair to say that COVID has turned our world upside down. I can't think of anything that I do today that's exactly the way that I did it 4 months ago, and I know that all of us are experiencing that. Sometimes it gets exhausting. For those of you who run behavioral health organizations, I know that you have had to change the way you do everything in a very short period of time. And I am so grateful for your commitment, creativity, and compassion that you have shown throughout this pandemic. Now, I know it's easy for all of us to focus on making sure that other people are taken care of. The theme for today's conference is taking care of the caregiver. What an important topic. But I want you also to know that we also mean behavioral health professionals need to be taken care of and need to take care of themselves. Throughout this pandemic, the National Council has been focused on supporting the important work that you do. Whether that's raising your concerns to Congress and the administration, let's try to get you financial support during this difficult time, the various resources that we've developed, the webinars that we offer weekly, or the way that we worked to make sure that you had personal protective equipment. These are all the concrete things that we're doing to support the field. Throughout all of this, the National Council has been guided by our North Star to make sure that people have the opportunity to receive high quality care that affords every opportunity for recovery. That is what drives the National Council every day. It has for the last 50 years, and it will for the future. It's also what drives me. I remember being a naive, bright-eyed 18-year-old when I moved to Washington, D.C. in 1985, and I started volunteering at a shelter for homeless women. I was so confused by what I saw there. All of these women obviously had serious mental illness, and none of them were in any kind of effective care. It was confusing to me that the only time these people saw healthcare professionals was when psychiatrists came at night to do interviews with them and to prescribe medications. I started hanging out with the social workers who were on staff at this shelter and was shocked by what I saw when I took people to go to city offices. The waiting list for affordable housing was 10 to 15 years long. There were no ongoing opportunities for care. If there was a problem, we called the mobile crisis team and hoped for the best. I started reflecting on all of these experiences, and that's when I decided that I wanted to be a social worker too, but I wanted to focus on public policy to try to create an environment that provided better ongoing support for not just these women, but for the millions of people around the country living with mental illness and or addiction. Little did I know that this process would also help me understand my family in a way I had never really understood. I remember distinctly being in my psychopathology class as a sophomore in college, and the lecture was about anxiety disorders and a particular form that bad anxiety disorders take called agoraphobia. And all of a sudden, my whole childhood suddenly made sense. Because, my mom almost never left the house. Going to the mailbox would fill her with dread. So you could imagine what it was like at significant life events, first communions, graduations, promotions in Boy Scouts or Girl Scouts. When you want your parents to be there and celebrate with you, we never knew if my mom was going to be able to be there. And leading up to those events, there would be so much anxiety in our house. It felt like we were walking on glass for weeks, and we didn't understand why or know that it could be different. And coming out of that experience, I suddenly had words to understand what was happening in my family. But I did not have an effective way for having a conversation with my mother about getting into care. I couldn't help her see that her life could be better, that our lives could be better. And truth be told, even if I had that conversation, I don't know that my family could have afforded any kind of care. So I want you to know that this work that we do at the National Council is not just important to me professionally, but also personally. The desire for everybody to reach their full potential, that recovery should be the expectation, not the exception, is the North Star for our organization and for me. And I know that we've made tremendous progress, but so much more yet has to happen so that everyone in this country can have that experience. It's not enough to have good intentions. We also need concrete strategies to move us forward. And the National Council has invested heavily in two strategies that I think are key to making this vision a reality. The first is the commitment that we've made over the last 10 years to make mental health first aid available in communities across the country. I'm so glad to report that over 2.5 million people have already had experienced mental health first aid, a course which not only teaches you the signs and symptoms of mental illness, but how to have a conversation with someone to get them into care, to support them, to make them feel loved, and to help them understand that treatment can make a difference. And on the treatment front, we know that it's still too hard for people in this country to access care. And that's why we are so committed to making certified community behavioral health clinics available in every community, in every state in this country. We want people to have access to coordinated, high-quality, evidence-based care. And these clinics have to not just provide that kind of care, but they have to serve everyone regardless of their ability to pay, regardless of their diagnosis, regardless of their insurance status. We want it to be as easy as possible for everyone in this country to get care when and where they need it. So I hope that you enjoy NatCon at home, that you leave here not just with some new tools, but also with a renewed sense of energy and purpose for the important work that we have to do together. Thank you so much for joining us, and have a great day.